Hi, Nick from In Control Physio here. Have you had pain after recently returning to a sport or hobby that you haven't done for a while? Well, this video is going to go over the common pain issue that you can get after either returning to or increasing in activity. We're going to go over how to fix the issue, as well as how to prevent it in the first place. So if this sounds familiar to you, you're going to want to stick around for this. Returning to or increasing how much or how often you do an activity is a scenario that can commonly cause pain in a variety of areas. It's something I see all the time in clinic, people coming back from running, tennis, or even gardening or interior decorating. And it's going to be super common this summer now that the lockdown restrictions are easing and people are coming back to a lot of stuff. Commonly, this can be a level of activity that you've handled just fine in the past, which can make it feel like it doesn't make any sense. It's something I've struggled with myself as well, as a teenager, before I'd had a better understanding of it.
Simply put, what is happening the majority of the time in this situation is the tendon is at this moment in time not able to comfortably handle the demand placed on it and is being overloaded, so you get this painful response. This is known as a tendinopathy, a disorder of the tendon due to it being overloaded either in the short term or through overuse. And there are of course different severities of this. It could technically occur in any tendon in the body, but some are way more common than others, like tennis elbow for example, which I've covered specifically in another video.
The good news is, you can sort out this type of issue quite quickly in some situations. Without getting into too much scientific detail, I'll use Cook and Purdam's widely regarded tendinopathy continuum model to explain. If you're interested in more in-depth detail of this sort of thing, just Google Cook and Purdam or Mallearis and you'll come up with loads of good stuff.
So as you can see, you've got three different severities, and it's known as a continuum because the severity can be reversed. Most cases, people will be in the most minor phase of damage, reactive tendinopathy. It's a short-term adaptation to overload that thickens the tendon, reduces stress, but can be more sensitive as essentially micro-damage has occurred. It's well understood that the tendon will revert to normal if the overload is sufficiently reduced or if there is sufficient time between loading sessions. This usually means activity adjustment, reducing or stopping the offending amount of activity to return to an appropriate amount of stress on the tendon. Targeted exercises can also help and are needed in quite a few cases. If the issue is allowed to go on a lot longer, with this overload happening on more occasions, it can move into tendon disrepair, in which recovery takes a little longer and the body's attempts to lay new tissue, or collagen, is poorer and less organised. Targeted exercise at the appropriate level to load the affected tendon is more essential here, particularly in relation to that last point. Exercise helps collagen organise better and as such is essentially stronger. More on the benefits of exercise rehab later in the video. The degenerative tendinopathy is the least common and most difficult to recover, and is only usually seen in the older population or people like athletes where the tendon has been chronically overloaded for a long time. Recovery tends to be quite poor from this stage, but most tendinopathies will not actually reach this far.
It can be difficult to distinguish clinically what stage somebody is at. Of course, there are overlaps. But the main key thing to take away from this explanation is, for the vast majority of people in most stages, you can do something to affect that tendon and not just stay where you are. So let's go over the best strategies I use to help people recover from a tendinopathy. Activity management. Identifying what you've changed pre-injury is the most important thing. This could be easy or hard depending on your situation, it might be really obvious or not. It's things like more manual work, new sports, or any repetitive action really. You've got to consider duration, intensity, time between sessions, as well as positional adjustments within those activities. Even if you haven't started something new, you may have done more of something, and recognising this is the best way to do something about it. As a teenager, I struggled with understanding this, when every summer I'd go back into playing tennis after not picking up a racket at all for about 8 months. I'd go straight back into play 3 days a week, but I'd be confused as to why I'd get pain. I'd be thinking, surely I'm in good enough shape to handle a few hours of tennis a week. And yes, it felt that way, sure, but the truth is, that sudden level of activity change was more than my body could comfortably handle. I won't be going into specific detail for positional adjustments as this is a broad video. But literally just changing your position slightly within the activity, or which hand or leg is doing most of the work, if that applies to your situation. It could be things like painting or how you're holding the wheel on a long drive. Just things like that can make a big difference. It's ideal to reduce rather than fully stop an activity, as this will have a more minimal impact on your life. However, in some situations where this doesn't quite work, total stopping for a few weeks may be beneficial. What's really important to know is prolonged total rest is almost never good, here especially, as with a tendon, if it has no load placed on it, or minimal load placed on it, it's going to get really weak and really poorly adapted.
Rehab exercises. So as well as helping to make that collagen formation stronger, exercises help gradually increase the amount of load that it would take for your body to become overloaded by. Again, I won't demonstrate anything specific as there are too many different areas to consider, but exercises should always be about readapting the muscle and tendon unit of the affected area so that it can handle the activity you want it to handle. For example, for shoulder, you can start with something like front shoulder raises at a light weight that you can handle with only mild pain and build up the weight. For your calf or Achilles, you do the same with calf raises.
And the last thing we're going to cover, how can you get better at preventing a tendinopathy? Well, this mainly comes back down to that idea of activity management. If with the activity in question, you start by increasing your session gradually, say one run a week, and then you increase the runs each week, rather than just one big jump, you're far more likely to keep your tendon within the amount it can handle, rather than overdoing it too quickly and causing pain. Simply put, you're far more likely to avoid this issue if you don't overdo it too quickly.